Welcome to Eye Contact. I'm Sathish Srinivasan. Today I'll be talking to Dr. Filomena Ribeiro from Lisbon, Portugal about achieving optimal cataract and refractive outcomes in patients who have got presbyopia and toric lens technologies. Welcome, Dr. Ribeiro. Good morning.
Good morning.
Is it common to have two presbyopia correcting patients who have exactly the objective outcomes, but personally they are not very happy? Is that common in your practice?
It's true. The premium IOLs, they could be very demanding process. Starts, of course, in the pre-op evaluation, but after surgery, we must reassure the patient what is going to happen. And right now we know that there are some issues like binocular summation, like neuroadaptation, so we must positively reinforce the patient to do all the process without complaint. So it takes time from us.
Sure. If you may, could you just walk through the process of how one goes about counseling these patients preoperatively, especially when they're going to have presbyopia correcting IOLs?
Yes, well, the very first is to assess the motivation. The patient needs to be motivated to spectacle independence. If not, for me, it's an absolute contraindication to use this kind of IOLs. And then we have some issues about personality, also lifestyle, visual distance needs. We must assess that. And then we'll go to all the process to check out everything, the cornea, the dry eye, if there is some irregularity in the cornea, check the pupil. It's a long process. We must be sure that everything is okay, that there is no problem with the contrast sensitivity like retinal issues or optic nerve disease. So everything must be checked out. Be sure that the biometric process, the measurements are okay, so we can proceed with this kind of solutions.
Sure. We all do meticulous preoperative evaluation and we plan surgery and the surgery goes uncomplicated. But sometimes patients land up with postoperative refractive errors, unexpected. What is your threshold? What do you think, how much of postoperative refractive error is tolerable? When do we intervene? Do you just want to walk us through your thought process?
Yes, well, it really depends a lot on the choice of the multifocal IOL. If it is an EDOF, for instance, they are more tolerant to residual error, including astigmatism, could tolerate almost 1 diopter. But if we are with trifocal IOLs, they are less tolerant to this kind of errors. So half a diopter, it's enough to have complaints.
And the next question comes, when do we intervene? What are the options available? Do you want to just talk us through that process?
If we have
postoperative refractive errors and when to intervene,
yes.
How long to wait?
Okay. Usually they are small errors. Right now we have a very good way to predict the spherical power of the IOL. Also we have a very good way to predict the astigmatism if we look or try to compensate for the posterior surface of the cornea and get the total astigmatism of the cornea. So we can end up with small residual errors, and in this case I think the excimer laser will be the best solution.
Thank you, Dr. Ribeiro, for your time.
Thank you.
Thank you for joining us. For more information and related topics, kindly visit us at EUROTIMES.org.